On this tutorial, we're going to look at some of the practical points used in assessing a long nodule. The guidelines on determining the follow-up frequency of long nodules vary according to publication, and currently the best used references are the Fleischner Society and the British Thoracic Society. It is also useful to learn how to measure these and how to analyze them correctly. We're going to use the Fleischner guidelines in 2017, and in this case it is recommended that the longest axis measurement is used, and ideally in the axial plane, and in this case we're going to measure it in this direction, which is the longest axis, which is coming to around 6.2 millimeters. It is useful to have a multiplanar algorithm, especially in order to decide if the longest axis of the nodule is in another plane. If that is the case, then the measurement should be made on that plane. In this case, you can see that the longest axis of this nodule is actually in the axial dimension, and therefore it is by convention useful to use the axial dimension. Useful crude cutoff for follow-up guidelines on long nodules are the actual longest axis dimensions, and according to the Fleischner Society, the numbers to remember are 6 millimeters and 8 millimeters. If under 6 millimeters, usually follow-up in high-risk patients is optional and no follow-up is required under current guidelines. References containing the detailed guidelines are highlighted in the links below.